We're back from lunch, and
Yes.
I think it'd be best to just go right into your opinions. Your Honor, do I have permission to do as we did with Dr. Hash, show the heading of the report?
Yes.
Thank you. So I'll put that up here on the screen here. Dr. Eastvold, is this the first opinion in your report?
Yes.
And maybe let's just read it.
Plaintiff suffered at most a mild concussion from the collision occurring on 2/26/2016.
Okay, so and why is that your opinion?
Okay, so when I'm forming opinion on whether there's been a concussion or not, there's three main things that I'm looking at. One, the mechanism of injury. Is it sufficient enough to cause a concussion? Two, the acute injury characteristics. What symptoms were present in the minutes and hours immediately after the collision? And then what did the clinical course look like after that? And I'm most interested in the 3 to 4 months after an injury. Things that are happening after that are less likely associated with the concussion. Okay, so those are the three things I'm looking at. So one, the mechanism. So there was a collision, two people ran into each other, he hit the ground. That is a feasible mechanism for an injury. Two, the acute injury characteristics. So there's two symptoms. One, loss of consciousness. Now, he's reporting 5 to 10 minutes of loss of consciousness. Based on all of the available evidence, that is improbable. And I can go into that more, but you've probably heard a lot about that. But my opinion is that if he suffered loss of consciousness, it was seconds, not minutes. Okay, the duration of loss of consciousness is important because the longer the loss of consciousness, the more severe the injury. Okay, so it is my opinion that there was seconds of loss of consciousness, if at all. And then by the time the EMT, Whitney Smith, arrived, she described some mild disorientation, which was kind of a rattled response to this unexpected collision on the ski hill. There wasn't any gross confusion or any other significant mental status changes. And then, of course, he was complaining of rib pain. So we've got the disorientation. He was seen at Park City Instacare 2 hours post-injury, and at that point he was complaining of a slight headache, rib pain, and I think a dullness in his head. But the provider there very specifically documented no signs or symptoms of concussion. There were no clear signs like dizziness, nausea, vomiting, any double or blurry vision, any of the really classic symptoms of a significant concussive injury. The next day, he was seen at the VA, and in the VA, he is only reporting, again, a slight headache and rib pain and irritability. Again, no other significant signs of an acute concussive injury. In the 2 to 3 weeks after that, the only person that really saw him was his girlfriend. And in her deposition, all she described was that he was really grouchy and didn't really want to be touched, and that he was in pain. She is also not describing any significant symptoms. Now, I know she's not a medical professional, but the absence of her description of other symptoms is notable. And then we've got some really important objective indices of injury. So, as we had started to mention before lunch, 1 month post-injury, he underwent an extensive battery of tests that assessed multiple aspects of attention. Now, attention is the cognitive domain that is the most sensitive to concussion. And he performed consistently in above average range on measures of sustained attention, complex sustained attention, divided attention, alternating attention, and selective attention. So very clearly, no objective indices of attention deficits. Then, 1 month later, so 2 months post-injury, he had a similar extensive battery looking at multiple aspects of memory. Same thing, no deficits. In May, which is about 2.5 months post-injury, he had a thorough vestibular evaluation. And so the balance system is actually really sensitive to concussion, such that even healthy, fit 20-year-old athletes will have impaired balance when they are concussed. So Mr. Sanderson's balance was described as exceptional. There was no evidence of vestibular dysfunction or balance problems. So that's another really important objective index of his brain functioning. Lastly, about a week and a half after the injury, Mr. Sanderson reported a markedly increased intake of alcohol. He reported to his primary care that he was drinking 5 to 6 drinks a week, 5 to 6 drinks 2 to 3 times a week, which is actually a quite significant amount of alcohol. And there's one thing about concussion is that one of the telltale signs is reduced tolerance to alcohol, such that when people are acutely concussed, if they drink alcohol, more often than not, they report feeling ill, or they get really intoxicated off of a fraction of the alcohol that they normally drink. Most people do not enjoy drinking alcohol when they're concussed. And so when I put all of that evidence together, sure, it's possible that he had a mild concussion, but at most it was mild. And by May, there really isn't any strong ongoing evidence of clear brain injury.
Is it possible that he did not have a concussion?
It's possible.
You mentioned in that answer the objective measures that were taken in evaluations following the accident. How would you evaluate the discrepancy that there might be between objective measures and a subjective report that vary? You know, and maybe that just for the jury's sake, and I can clarify my question, the patient is reporting certain experience of symptoms versus an objective finding through some sort of assessment.
Well, it's hard to make sense of, and there could be many things, but one of the most prominent things that was very clear is that his anxiety went sky high after this injury. His blood pressure was through the roof. He was emailing his provider saying, "I'm having a hypertension crisis." He was doubling his medication, and it wasn't helping. So it was very clear that he was experiencing a lot of anxiety, and anxiety can certainly drive perception of a lot of these difficulties.
Did you note a record a few weeks prior to the ski collision that included Mr. Sanderson's report that he was feeling old all of a sudden?
Your Honor, I don't think that's in her report, because I haven't seen it.
She's
overruled?
Have you reviewed that record?
I definitely have. And
does it play into your evaluation of where post-accident symptoms might be coming from?
It plays into me trying to understand where he is now. And there's been a lot of talk about decline, and some of those records offer some telltale signs that I see in older adults that decline is starting to happen. So there's a line in there that describes that he's overwhelmed with paperwork and trying to get things organized, and he's I can't remember the exact line, but those are the kinds of things that I'm listening for when I'm evaluating older adults, because those are the behavioral signs that functional changes are starting to happen in someone's life.
Okay, great. Let's go to your second opinion here. Give me just a second to pull it up. As I pull it up, you can read it, Miss.
Sure, I can read it from my
Dr.
paper.
Eastvold. Yeah, I apologize.
Plaintiff's course and evolution of self-reported symptoms is inconsistent with the known trajectory of concussion-related symptoms. So,
why would you say that?
So the thing with brain injury is that the symptoms are worse in the beginning and then they gradually improve. Now that rate improvement can vary greatly among individuals, and some people might experience some plateaus along the way, but brain injury does not progressively worsen. And Mr. Sanderson was reporting when he saw Dr. Fung in 2017, about a year and a half after his injury, and then Dr. Goldstein in 2020, he was reporting new symptoms that weren't present in those first 3 months, and he was describing a worsening of symptoms. And I think many of his family members are under the impression that things are worsening. So a worsening in 2017 and 2020 cannot be attributed with any medical probability to a concussion, a mild concussion in 2016.
And maybe so the jury has a sense of the new symptoms that you're describing. What are those in particular?
He was describing neck pain. There was some dizziness and a lot more just general dysfunction. I can't remember all the symptoms offhand.
Sure. What symptoms would you attribute to a concussion if, in fact, he did have one in the ski collision?
Well, again, there really isn't any strong evidence of symptoms in those first 3 months. He wasn't even really, he was reporting difficulties with his thinking skills, but yet on objective tests he was performing normally. So it's difficult to separate what was anxiety during that period and what was true concussive deficits. But I think another piece is that even one of his daughters saw him in May, I believe, for a graduation, and described him as feeling kind of slow and dull, not as engaged as he usually is. And that could certainly be a symptom of concussion, but even she said that fully resolved, and he has since returned back to his extroverted self. And so, again, that's the known trajectory that I would expect for a concussive injury, but not new or worsening symptoms years later.
Thank you. Let's move to your third opinion, unless there's anything to add.
I think that suffices.
Okay, thank you. So number 3, will you read